Now, just back to the patient records and the next tool that I want to talk about. So if you would like to check whether a patient's symptoms and findings meet the criteria for a referral, and this is all based on the NG12 guidance, then this is where the Cancer Analyser tool can help you. The Cancer Analyser tool is working with the NG12 guidance, the latest NG12 guidance, and it's again letting you know next steps for that patient based on all of their symptoms and all of their findings. This particular resource is only available to those practices that are using Resource Publisher. If you are a practice that's using Template Manager, unfortunately, we cannot deploy it to your system because it's such a big protocol which relies on different concepts. Without getting so technical, it does cause issues when we're trying to get it into Template Manager sites. But EMIS have promised that anyone that is currently not a Resource Publisher site, by September, you should hopefully be moving over to Resource Publisher. And if you don't know whether you're a Template Manager or a Resource Publisher, the easier way to find out is if you click on the EMIS bubble and down to configuration, either you're going to be seeing Resource Publisher here, or you're going to be seeing Template Manager. So if you see Resource Publisher, you can use this tool. If not, it will be coming for you soon. Now, how to use the tool, it's based on the use of templates. So when in a consultation and you click on the Run Template option, what you're searching for is a suspected cancer symptoms template. So you just type that in there and that will find you that template. And again, if you're a Template Manager, it won't come back. So that's another sign that you're currently not a Resource Publisher site. Now, when you launch this template, this is the initial template that you would use to capture as many symptoms and findings as you can for that particular patient. So whatever that patient is presenting with. And the more symptoms and the more findings that you can capture for that patient, the more accurate the guidance will be on the next step, which I will show you. So on the left-hand side here, you can see here that we've broken it down by specific symptoms if you want to record that information. So you've got abdo, you've got bleeding, you've got gynae, you've got lumps, etc. So you would use the pages on the left-hand side to complete as much information as possible. So I'm going to pick up that this patient has abdo pain and they're also experiencing rectal bleeding. So you would go ahead and complete as much information as you can. Now, before you click on Save Template, always remember to complete the 2 hashtag pages before you click on Save, because this is then ensuring that you're picking up anything else as well before you then go to the next stage. The non-specific features page will again pick up any non-specific features that you feel may suggest, again, possible signs of cancer. So here, I may want to say that my patient is also, I don't know, I'll pick one of the options on there. I'm going to say experiencing weight loss, but you can also capture smoking status if needed within this page as well. The primary care investigation page allows you to look at the patient's blood tests, their recent blood tests. This is really good because it saves you having to go through the patient's record. It saves you having to go through the investigations tab. What we've done is we pulled through the most recent relevant blood tests that you may want to look at. And then on the right-hand side, you'll be able to see whether or not that patient has that particular blood test and when. So here I can see the patient's had a hemoglobin on the 4th of August, and this is what it was. If I scroll down further, I can then further explain those blood test results if I feel it's necessary. So for instance, I'm going to pick up anemia as an example, but you've got iron deficiency there, you've got different ESRAs, you've got different options that you may want to use to further explain those particular results. Also, imaging tests as well. So if you want to record the fact that the patient's had an X-ray or an ultrasound, then you can tick the relevant information using the boxes provided. And once you've completed all of that information, so again, it's just stressing, make sure you capture as many symptoms and findings as possible. You then click on the Save Template option. And what that will then do is it will bring up this multiple choice question box, and it will answer you whether or not you're ready now to launch the Cancer Analyser template. And the Cancer Analyser template will give you your guidance based on the symptoms and findings that you've captured. If instead you want to go back because you want to capture more, then you can say no, or you can exit if you wish. But the next step is obviously saying yes at this point. This will then launch the next template, and this template is where you'll get all of your guidance. So the symptoms page is based on visibility rules. It will only show you the options that you have selected for that particular patient on that day. And then on the left-hand side, depending on what you've picked, so remember I picked abdo pain, so therefore it's giving me the full guidance around abdo pain. And I also picked rectal bleeding, so therefore it's showing me guidance around bleeding as well. So here's my full guidance on each of the particular symptoms that I picked up. But at the very bottom, I've got just a one-stop summary page of everything that I need to complete next for that patient, based on all of the symptoms and findings that I've captured in that very first template. So the nice recommendations here, based on, and I'm not clinical, so please excuse me, I just picked some options just to show you what it would do, but it's telling me here, maybe I need to offer an urgent chest x-ray, I may need to look at referrals. These are the referrals I need to be doing. So it gives me all of the guidance that I need. And down the bottom, I can type in any additional information if I wish to explain the outcome that I've taken now that I've viewed this particular information. And then I can go ahead and save it and then do the following next actions as required. We're going to go back into searches later, but also to let you know that we have searches based on the use of this tool as well. So we have searches, actually I'll show you the searches now just because it fits nicely, but if I go into the population reporting module and back into the network contract DES searches, remember earlier we visited the early cancer diagnosis folder. And if you look at the work done and you look at the referrals and diagnosis, notice there that we have searches based on the use of our NG12 analyzer tool. So it will be able to report on you from the use of that. These are the 2-week wait referrals that have been made since then. From the use of that, this is the new diagnosis that have happened within 6 months. So that you've got that referral activity and trend and theme to report on for your practice if you need to. So that's our Cancer Analyzer tool, and hopefully that makes sense so far, but please do let me know if there are any questions. We have step-by-step guidance on all of this information that I'm showing you here today so that we can send this on so you can refer back to that and share it with your colleagues if you need to.